Welcome to the Medicare Part A Blueprint. In this training, we're going to break down the foundation of Medicare, Part A, also known as hospital insurance. Understanding Part A inside and out is critical for every agent because this is the starting point for every Medicare conversation you'll have with a client. Think of Part A as the foundation of a house. Without it, nothing else stands. By the end of this training, you'll understand exactly what Part A covers, how clients qualify, what it costs, and how to turn that knowledge into a consultative strategy that builds trust and closes business. So let's start with the basics. What exactly does Medicare Part A cover? Part A is hospital insurance, and it kicks in under specific inpatient and facility-based criteria. There are 4 key components you need to know. First, inpatient hospital care. This covers stays when a client is formally admitted to a hospital. Second, skilled nursing facility care. After a qualifying hospital stay, Part A can cover up to 100 days in a skilled nursing facility. Third, home health services. Part A covers certain home health care services when a client is homebound and needs skilled care. And fourth, hospice care. For clients who are terminally ill with a life expectancy of 6 months or less, Part A covers hospice services, including pain management and comfort care. Now here's where it gets important for your client conversations. You need to clearly understand the boundaries of Part A coverage. What's inside the foundation? Hospital stays, skilled nursing, home health, and hospice. That's it. What's outside? Everything else. Doctor visits, outpatient procedures, prescription drugs, dental, vision, hearing, and long-term custodial care are all outside the scope of Part A. This is a huge gap, and it's exactly why your clients need additional coverage. When you frame it this way, you're not selling. You're educating, and that's what builds trust. Let's talk about eligibility. How do your clients qualify for premium-free Part A? There are 3 pathways. The first is the work history pathway. If your client or their spouse has worked and paid Medicare taxes for at least 40 quarters, that's 10 years, they qualify for premium-free Part A at age 65. The second is the spousal pathway. Even if your client hasn't worked enough quarters themselves, they may qualify through their spouse's work history. This is especially important for clients who were homemakers or worked in positions that didn't pay into Medicare. The third is the disability pathway. Clients under 65 who have received Social Security disability benefits for 24 months are automatically enrolled in Medicare, including Part A. But what if a client doesn't qualify for premium-free Part A? That's where the premium stepladder comes in. For 2026, there are 3 tiers. If a client has 0 to 29 quarters of work history, they pay the highest premium. With 30 to 39 quarters, they pay a reduced premium. And with 40 or more quarters, they pay 0. As an agent, this is critical to assess, especially with late enrollees. Always ask about work history. It can dramatically affect what your client pays each month. Now let's break down one of the most confusing parts of Part A, the benefit period. Here's how it works. The benefit period starts the day your client is admitted as an inpatient to a hospital or skilled nursing facility. It continues as long as they're receiving inpatient care. Once they're discharged, a 60-day countdown begins. If they go 60 consecutive days without being readmitted to a hospital or skilled nursing facility, the benefit period resets. This is important because costs reset too. Each new benefit period means a new deductible. And if a client is in and out of the hospital frequently, they could face multiple deductibles in a single year. Understanding this cycle helps you explain the financial exposure your clients face and why supplemental coverage matters. Let's bring it all together. Everything we've covered today, the 4 components, the coverage boundaries, the eligibility pathways, the premium tiers, and the benefit period mechanics, these aren't just facts to memorize. They're the foundation of a consultative strategy. When you sit down with a client, you're not just explaining Medicare, you're identifying risks. What happens if they don't have enough work quarters? What's their exposure during a benefit period? What falls outside Part A that they'll need to cover? By framing your conversations around these gaps and risks, you position yourself as a trusted advisor, not just a salesperson. That's the Part A blueprint. Know the foundation, identify the gaps, and guide your clients to the right solution. Thank you for completing this training, and good luck out there.